Hello and welcome back to Because. We're here today with two doctors from Amita's Alexian Brothers Behavioral Health Hospital who are going to talk with us about a topic that's been in the news lately, especially with some high-profile deaths from opioids. Welcome, doctors, and could you introduce yourself, please?
Of course. My name is Dr. Sarah Briley. I am the clinical director for the addiction service line at Amita Health Alexian Brothers Behavioral Health Hospital. I've been with Alexian Brothers for the past 13 years. I've been working in the field of addictions for about 15 years. My specialty, of course, is addictions treatment, also treatment of millennial patients, and we're very excited about some new opportunities that will be opening up in the system.
Good morning there. My name is Dr. Syed. I am a psychiatrist with subspecialty training in addiction psychiatry. I have been with Amita now for about 6 years, and I work in our chemical dependency department within the health system.
Welcome to Because Show. We're so glad that you could be here today. This is more of a serious topic than we usually cover on Because, but we're very grateful that you could be here today to share the information with us.
Sure.
For people battling addiction, what sorts of treatments are available at the hospital?
Well, I think we have a pretty elaborate treatment system at the hospital. Well, we start off with acute stabilization for patients who are going through any withdrawal. We have an inpatient detoxification unit that's available, and we're actually doing an ambulatory detox as well for people who want to stay at home and come for treatment. We have outpatient treatment, which is a step-down process that include our partial hospitalization program and intensive outpatient program. And we have an elaborate aftercare plan that we kind of tailor to each patient's needs, inclusion of therapists, self-help groups, and other community support systems.
What trends in addiction are you seeing in our community?
Well, I think there are different trends with different age populations. I think in the millennials, we continue to see cannabis use as an ongoing problem, but we're also seeing different designer drugs come into play here. We're also seeing a lot of synthetic drugs and over-the-counter drugs, which we typically don't expect people to abuse, but the millennials have really found some benefit from some of these over-the-counter drugs. And as with all age brackets, I think, related to addiction, opioids continue to be a growing problem. Mm-hmm. And in the adults, we continue to see alcohol-related problems, cannabis use problems that are going on even to our older adults, ages 50 to 65, and we're seeing a lot of these people come into treatment as well.
As friends and family members, what are the different things that, say, a parent of a teenager would look for versus a loved one of a senior citizen?
Well, I think with our young adults and with our teenage population, I think that there tends to be a somewhat lax attitude in the community about drinking. Alcohol is still our #1 problem for our adolescent and young adult population, and then again in cannabis. So the things that a parent would look for would be changes in behavior, change in peer group, mom and dad not knowing who the friends are or the peer group, lying, stealing, a change in appearance, so taking care of hygiene. Also, particularly with opiates, you're looking for things like dilated pupils. And so we ask parents to be really kind of in tune and know their children and pay attention to changes.
Mm-hmm. Are there specific warning signs you would look for?
Well, I think Sarah did a good job of kind of highlighting the areas such as the psychological changes you see in children who start to abuse substances with the mood instability issues, irritability, agitation. She also mentioned the behavioral changes. Start to see them skipping school, their grades starting to decline, a change in friends. And the physical signs, you may see intoxication, the people with tremors, bloodshot eyes, bleeding noses. So I think there's a whole spectrum of physical, psychological, and behavioral changes that parents have to be on a lookout for.
Mm-hmm. You mentioned cannabis. With the legalization of medical cannabis in Illinois, how does that affect what's going on in our community and treatments?
We have not seen this affecting the number of admissions for primary cannabis use disorder. However, there tends to be a shift. My belief is that there's a shift in how people perceive cannabis use, and there tends to be a somewhat lax attitude in the community about cannabis use. And a lot of our younger patients are saying, oh, well, it's going to be legalized, it's medical marijuana, and so forth. We treat cannabis use disorder no differently than we do any other types of addiction. So, for example, alcohol is legal for people who are of age, but it's still very problematic. And also prescribed medications can be addictive as well. So we treat the use of cannabis that way. If it's problematic, it's problematic.
What are you seeing as far as an increase with in addiction with people with pain medication and other prescribed drugs?
Well, this has been an increasing topic to discuss in medicine in general. We're, as physicians, expected to balance pain issues with awareness of addiction issues, and that can be a tough challenge with the demands of the patient and other organizations that monitor that what we're doing is appropriate. So we are seeing an increase in pain medication usage chronically for various medical issues, and this is starting to show more problems in adults now who are not getting enough pain medication from pain relief with their pain medication and starting to transition to heavier drugs or other drugs or so-called buying off the streets to supplement their supply.
For an individual, what would the warning signs be that maybe those prescribed drugs had become a problem?
Well, I think some of the early warning signs seems to be if you have someone who is running out of their prescription early, they're trying to get refills sooner, if they're going to multiple doctors to get pain medication, and if you start to see mood issues and behavioral issues as patients are using these medications faster.
There's been a lot of publicity about the antidote to opioid overdose. Can you tell us about that and some other medications that are available to treat addiction?
As far as the overdose, there's a medication called Narcan. It essentially reverses the acute intoxication and overdose of opioids. It's a good medication. It's a life-saving medication. We've been teaching all our first responders how to utilize this medication, and there have been some programs where we even get people in the community to have this medication if they have an overdose. Our goal is to save lives, and if this medication can do it, we're going to try to utilize it. I don't know if you have anything else, Sarah, you want to do?
No, it's something that we're also seeing our ER physicians use as well because they need to respond very quickly, and our goal is to keep people alive. Now, in addition to that, you had asked about relapse prevention medication and other medications we use. We do utilize a variety of medications to assist in the recovery process, and Dr. Syed perhaps could speak about that.
Yes, we have several FDA-approved medications for people struggling with opioid or heroin abuse. Both work similarly in the brain. Historically, they have used medications like methadone, but we've kind of moving away from that, and we're using what we call buprenorphine products that can help people deal with the acute withdrawal phase as well as maintenance phase to help with cravings and urges while we add that psychosocial treatment to them. And the goal is eventually to get them off these medications as well. We also have medication called naltrexone, which comes in a daily pill form, and a monthly injection that can help people abstain from opioid use as well. I just have to emphasize these medications are great tools, underutilized, but they really work well in conjunction with some type of psychosocial rehabilitation as well.
So if left untreated, what are the long-term repercussions of substance abuse to the individual, the family, and our community?
Well, I think there's a huge loss to a society in general because we're losing a potentially productive member of society. It really is a family illness. It really destroys the family. There are both short and long-term effects of substance use. Short-term effects including acute intoxication, which could lead to overdoses and death, withdrawal, which could be very uncomfortable, and at that phase, that's when people really want to go back and use the substance just to feel normal again. And the long-term effects are the effects on the brain, the cognition, executive functioning, memory. And the earlier you start using a substance, the higher risk of impairments in these areas of brain functioning. And through research, we found that the brain is developing even into your mid-20s. So when people are starting to use drugs or alcohol as a teenager, you're really affecting the long-term potential for the brain.
Do you see any other mental health issues associated with substance abuse?
The majority of the patients that we serve at our hospital present with co-occurring symptomology. And this is one of the things...
Oh, hold on. Those are big words.
Okay, so what does that mean? It means that substance abuse goes hand in hand with other mental health conditions.
Great.
So I would say approximately 80% of the patients that we work with in our program have an additional mental health diagnosis. What makes us a little bit unusual compared to some of the other mental health service providers is that we treat so many different conditions under the same roof, which allows us to treat the whole person. So for example, if a patient comes in complaining of anxiety disorder, we'll do a very thorough assessment and then we can treat both parts. And so what we believe is that if you don't treat the whole person, that you put the person at risk for relapse in both areas.
And you're inpatient and outpatient?
Correct.
Yes.
Okay. Do you have any new services that have been added to help people with these issues?
Oh, we're very excited
Yeah.
about this. We will, early in 2017, we will be opening up a residential facility on our Elk Grove campus. So it's going to be a 48-bed unit that will serve patients presenting with both anxiety disorders and OCD and addictions. And it will be primarily for those folks who have not been able to be successful at a lower level of care and need to be out of the home environment while they receive services. We had been lacking this level of care in our system, and we recognized that it was a missed opportunity in our community. And now people coming from our inpatient program potentially could go to residential and then follow up with one of our outpatient programs.
Okay.
I think this last piece really helps with continuity of care. I think that's very important for these patients to feel comfortable and get the help they need, because we can see them from the inpatient when we first detoxed them to either residential, outpatient, and then in our clinics eventually. And we have several therapists that we work with, both within our organization and in the community, and we could really provide comprehensive long-term treatment, which gives us the best outcomes for these individuals.
Group support is often so important in recovery. Do you have groups for the affected individuals and the families?
We have a very robust recovery community at Alexian Brothers Behavioral Health. We have 12-step meetings that meet daily. In addition, we have Families Anonymous, which is a group that is targeted at parents who have a son or daughter who has an addiction. We have an Al-Anon group that meets, Cocaine Anonymous, Gamblers Anonymous, Alcoholics Anonymous, Narcotics Anonymous. 7 days a week we offer group support in our hospital.
So almost every day there is support to be had.
Yeah.
Yes.
And I think we also have family nights, certain nights of the week that really are open not just to our patients and their families. Anyone in the community can come and get presentations by experts in addiction regarding different areas within addiction, such as the biology of addiction, the psychopharmacology of addiction, the psychosocial aspects of addiction. So that's really open to any community member at our hospital.
Do you also work with local social service agencies?
We do. We always want to provide patients with the best care, and part of that is a comprehensive discharge plan. So we will, if we're not able to meet a patient's need, we work with other providers in the community, one of them being our Alexian Center for Mental Health in Arlington Heights, which is part of our network.
If someone has a problem, what's the first step to take?
The first step to take, especially when you're talking about addiction, is to get that person into services as quickly as possible, or come in for an assessment as quickly as possible. They can certainly call our call center Monday through Friday until 6 p.m. And talk to a trained professional. But acting quickly is really it's very prudent that you have a person talk while they're still motivated.
Okay, and for more information on your hospital, do you have a website that people can refer to?
We do. You can find us at our URL, amitahealth.org, and then there's a link on that site to our site.
Well, thank you very much for joining us today. It's been a pleasure
for you to
share this information with us. We appreciate it, and I'm sure our community will too.